Welcome everybody, with you Dr. Magdi Abdelrazik, consultant of infectious disease, hepatology and gastroenterology. Our topic today about abdominal distension and bloating. These symptoms usually present in some patients, and this is due to more air present in stomach and gastrointestinal tract. Mostly this patient usually during eating, maybe he speak or laugh, so more air enter the gastrointestinal tract and accumulate in the stomach, and there is difficulty in passage of this air from anus or through eructation. So its accumulation in the gastrointestinal tract lead to pain, maybe lead to reflux, esophageal reflux, and may lead to shortness of breath, and sometimes this patient sometimes suffer from colicky pain. As regards this bloating and abdominal distension, there are many causes of these symptoms. First of all, swallowing of air during eating. But sometimes some diseases cause this abdominal distension and bloating, like Crohn's disease, like ulcerative colitis, or inflammatory bowel disease. Also, sometimes constipation lead to accumulation of the gases in the stomach and intestine. Sometimes dyspepsia, sometimes diabetes mellitus, sometimes hypothyroidism also lead to bloating. In some cases, we find cirrhosis in the liver. In some cases, we find heart failure. So there are many causes lead to bloating or abdominal distension. So we advised to make some investigation, like stool analysis. Sometimes we find worms or parasites or indigestion. Sometimes we make liver function tests. We may find chronic liver disease. Sometimes make pancreatic function test, like serum amylase or serum lipase. Sometimes we make thyroid function test, like free T3, free T4, TSH. Sometimes may find hypothyroidism. And in some cases also we make abdominal sonar or CT scan abdomen and the pelvis. Sometimes we find ascites. Sometimes we find tumor, maybe in the uterus, maybe in the ovary. All these cases lead to abdominal distension. Sometimes we find also some disease like cystic fibrosis or diverticulitis. All this disease may lead to abdominal distension and bloating. So we have to make differential diagnosis, and also we have to diagnose why this patient has bloating and abdominal distension. After that, we have to treat this patient. The treatment depends on the cause. So if there is constipation, so we have to treat constipation by laxative, or to know the cause of the constipation and treat it. Also, as regards peptic ulcer disease, sometimes we give omeprazole to treat chronic peptic ulcer disease. Also, sometimes we give some medications to treat indigestion, like Digenorm syrup in the children, or Digest-Ease capsule 3 times per day, or Digestine tablets. This medication treat indigestion. Also, sometimes we prescribe eucarbone or disfilatil. All this medication treat to absorb and to relieve the distension and bloating of the patient. Also, we advised this patient to avoid smoking or avoid Pepsi or cans. Sometimes also eating cabbage or cauliflower or pickled food may lead to the problem of bloating and abdominal distension. So we advise the patient not to eat too much cauliflower or cabbage or pickled foods. Also, we advised the patient to eat a small amount of foods 5 or 6 times per day. Also, we advised the patient not to drink water directly after eating. It is better to drink water before eating by at least half an hour. As regard also this patient, we advise them to follow sports daily. It is very useful for them. Also, we encourage them to eat fruits and vegetables. As regard this patient, especially children, to avoid eating biscuits too much. As regard this patient, also we advised them to eat yogurt daily. This is considered probiotic and will relieve the abdominal distension and the gases and improve their condition. Also, we advise them not to speak during eating because this speaking may lead to entrance of more air in the gastrointestinal tract. As regards this patient, if he follow this advice, its condition will be improved too much. Some patient has psychological problems or tension. Sometimes we prescribe some anxiolytic to relieve this tension. Thank you very much.